Okay, good morning. Mark Donegan, self-healing practitioner and educator, ordained minister, aka Goldilocks. I'm hoping the sound on this will come out. This is a real pain in the ass. They have no gear here to show whether my sound is working. That's just lame. So these YouTube things, they work or they don't. And I really get tired of sitting here really trying to put my heart into these, and then they don't come out. And then how do you do a retake when you're trying to put your heart into something? The words just don't come out the same. Um, so I'm not even sure my video from yesterday showed up. It was mostly just whining about my physical body, which is like a daily routine. I mean, you got to kind of whine every day if you're broken really bad. I guess even if you are not broken, you got to whine every day. Swamping's part of self care. You know, feeling sorry for yourself every once in a while, but not doing it so you don't stay there. Because so many people just they're so sorry for themselves, and their injury is their life. And I have no way of not having an injury for my life. Hey, Greg, looks like you popped in. Do I got sound, or am I just sitting here talking to myself? Well, I guess it wasn't you. Well, anyways, uh, yeah, physical problems and trying to set yourself aside from them and having a life other than your physical ailments. For somebody that's got a severe disability, that ain't easy. Or like, or if you, I often think about people that don't have their limbs. My Facebook, man, there's troubles you can cause on Facebook. I mean, I really have a good time. I hate when I'm banned. It really sucks. And I usually get banned for my comments rather than my posts, which is also very funny. So yeah, living outside of your ailments, it's just really important. Even if you're having to work on your ailments all day, which is kind of my case. And then there's another aspect I run into I want to really throw out. Again, it's about self care and people in society putting so much, we're brought up wrong. And so when we do get injured, we won't take the time off that we need. We won't rest. We won't lay down. I'm finding out how difficult it is to just lay down and take my pain. I mean, seriously, these are really neat things and I'm learning because I went off opiates and I'm back on opiates, if you want to call it that way. It's very interesting. I'm on opiates, but I don't only take them when I to prevent me from going to the hospital, basically. Okay, so I don't take them every day. I'm not supposed to take them every day, so I'm on them in that way. The way I was on them before was the normal way they do people, which is daily and all day. And so, anyways, doing what I'm doing and doing what I've done for years, not having opiates for the last 5 years. Um, I've learned you got to lay down and take your pain. And so now that I'm having them once in a while, I found out that they affect me in a very different way. It's like I had to explain to the doctor. Um, they literally make me more ill in certain ways, and I can't get up. So when I take one, again, it's like I'm going down. It's like going to the hospital. But it's to make it to where my body, it's not even about my mind anymore. It's about letting my body relax and decharge out of that tensing situational pain will put you in, when you've got it constantly. So interesting aspects of going into deeper levels of pain than I've ever done before. And I gotta, preface this by saying that my entire left side barely moves. The constriction of the nerve, well, I'm bone to bone on the nerve. How the leg moves at all, I don't even know. But when you've got pressure on the nerve. Okay, so that leg, you see, so what's happened is it's come up my left side. And it's all the way up to my chest now on the left side. And the pain is most intense in the abdomen, chest, side area, all of it. I mean, the doctors are kind of freaked out by it. I've been to a shit ton of them. I've had every kind of diagnostic you can have. They don't talk to me a lot like what they're looking for. And doctors, that's another thing I want to talk about is freaking doctors, man. They're just flipping human beings. And a lot of them ain't very fucking good at all. Just straight up. They ain't good. They also have to do another thing when you're a doctor. I want you all to understand because you got to get callous to losing people. You understand that people get old. You also understand that people get old, get injuries, and have pain and ask for pain meds. And doctors don't know how to handle that. The only way they know how to handle that is giving you another med to change your brain to knock you down. That's what they do. They just want you quiet at home and die slowly and peacefully. And that's never been me, and they never liked me for it. So just understand it. That's how doctors do. Every single one of them, even the ones I like. That's why I like them. They're willing to let me go, and we're willing to say that to my eyes, and work from that understanding that I'm okay and ready to go. But in the meantime, let's use everything we got and you got in your brain to make this a little easier on me without knocking me down and taking me out of life, which is what doctors tend to do, is take people out of life. They're just like, oh, they're wounded. They're good for, they can hang out at home for a year while they're recovering. Boom, and they totally, you're disregarded. And they also, the number one thing they like to do is uh, devalue or not, there's a word for it that I'm not coming up with, but it's to not give value to your words, to a patient's words about how they feel about what's going on in their body. Doctors get numb and immune to it, and they will just not listen. And they will hear the first words out of your mouth about maybe what area. They'll come up with their own conclusions about what's going on and not listen to the fine details. And, that's the thing about finding a good doctor is you want somebody that's going to listen to the fine details. And I have fine doctors, but even in certain times with so much going on, they can't keep up. And it's life. People get old, they get too many problems, they die. That's the cycle. And as you get older, the doctors get more lost, and it gets harder to keep them up to pace with all the different things going on. And you look a lot of old people why they die. I mean, they come up, but it's usually a doctor not doing the right thing or an interaction, other meds, and they have great little ways of playing it off so doctors don't get sued, and we need these doctors. But yeah, it's our current medical situation is not good. There's no way to correct doctors that we have. We have very few doctors, and there's nothing we can do about that. That's just the way it is. And yeah, the unavailability of medical stuff, and then it not being good even once you get there. That's more killing us than anything else. But again, when you taking your own stuff and living with it, no matter what it is, keep the doctors to a minimum with the intake you take from them. Uh, and I'm just saying this because I don't see one doctor for one thing. I see two or three on everything, and their opinions are always different. And in the end, I always have to take my own road. So yeah, take your own road through everything. And my personal stuff, like I said, it's very complex. There's probably a half dozen. I mean, the doctors haven't even. We're at hold right now. I'm in limbo. They're trying to figure out just exactly what my new current problem is. But you could throw it on about a half dozen other serious issues, mostly to the left side, which is kind of interesting. But they have to be taken step by step, one by one. There's a priority order, like I was telling my daughter. We can't just go in and fix everything. It's, again, the doctors don't work that way, and in this case, the body doesn't work that way. I don't know anybody would go in and have that many surgeries all at once. So, yeah, we have an order to go through, and it'll be low back, middle back, probably knee, hip, and that's after we clear up the blood problems so we can take care of those issues. Um, so for me, yeah, it's going to be, I've known this for a couple of years now. I was heading into a year or two period of surgeries and dealing with stuff, getting it taken care of, and pushing, and not pushing, but just working my way through it as gently as possible. And that's what I'm doing now. And it's not why I went back on opiates, but it is kind of. I needed to give my mind a break. I knew it. But what happened was I ended up in a situation where I didn't have much choice. And the doctors were very clear that, this is not the. I mean, you go to the emergency room and you wait anytime you want, but I just don't want to keep going over there for pain. So I agreed to take the prescription and keep these things around in case I need them. And like I said, it's not a good way to go, but you do what you got to do given your situation, and now situations are always changing. I'm very clear that again, you get older, things cascade, and I've got a lot of issues, and I just know they are cascading, and there's going to come a point I'm under their care, and they're going to cascade, and that's going to be where I really have to stay tuned in. That and just hope my daughter can pick up the rope for me with these doctors and keep them all in line, and that's who it would fall to anyways, and that's why I'm sitting here doing the best I can. I don't want that falling onto her. It's just another thing she'd have to deal with getting dad to a doctor. Uh, so dad can do that by himself for now. And yeah, I have him in home care, and I've done all the other self care things to make sure that the whole process is as good as it can be. So, anyways, I hope the sound came on this. I'm gonna go check. If it did, then maybe I'll do another one some other time. All right, later.